Hey guys, so in this video, I actually asked in my nursing related group, as far as nurses and CNAs, any advice that they would give for somebody who is a preceptor or who has an orientee. And I'm sorry, it's starting to get dark, and that's why you see the flashes from the TV. It's muted right now, so I apologize if that bothers anyone. But I just took screenshots of people's responses. And again, this is just advice that other nurses and CNAs have for nurses or CNAs who are training someone or precepting, like for a nursing student or a person who is in CNA training. So I have a bunch of screenshots, and that's basically all this video is going to be, is advice from other nurses and CNAs to other nurses and CNAs for orientation or precepting. So the first advice is meet your orientee before you start so you can learn their skill set and needs. Which I definitely want to add that I think that's really important, because if you don't know like what they already know or what they need to learn or what they need help with, how are you supposed to help them learn those things? This person said, at the end of the shift, ask them how they felt their day went, areas that they want to spend more time with as far as training, and things that they feel comfortable with that they don't necessarily need the additional training time with. This one is kind of a long one. So this one says, first of all, praise them when they do a good job. Always teach them the right way to do tasks, no shortcuts. For example, whatever your facility's policy is, do it following those policies. Never belittle the preceptee or orientee in front of any other employee, RN, or staff. And that should go for just like any coworkers, not just orientees or people that you are precepting. Then she says, give them a chance to delegate to you. Show them how to use the available resources, such as how to look up policies, respiratory therapy, case management, physicians, physical therapy, pharmacy, lab. Show them how to shoot ideas off of other nurses, etc. And last but not least, stay positive the entire shift. Try not to complain in front of your orientee or the person you are precepting. So she also added, when I first started out, what really bothered me was not giving or getting a good report. It was really stressful because I thought the other nurses and even my patients thought that I didn't know what was up. Show your preceptee how to tell the full story for a report. And then she kind of broke it down, but obviously I don't have the editing software, or I don't know how to use my editing software to add like the pictures into the video. So I apologize for that, because she did have it like written down how she likes to give report, like as far as her notes and things like that. This person said, on the first day, give them a tour of the unit, introduce the staff and the unit manager or floor manager or charge nurse. Involve them to make them feel included. Be the example, solicit questions, and ask why they did a certain thing the way that they did. Not to question their actions, just to stimulate feedback, because they don't have to do things the way that you do it. Allow them to have autonomy, but be a shadow and monitor what they're doing. It's a good experience for the both of you. Somebody else said, smile and nod and make sure that you let them know that it was a great idea if they had a great idea. This person said, set goals for the shift and what they personally want to achieve for that day. For instance, they want to complete all charting by 11 a.m., or they want to participate in grand rounds, or what they want to achieve or to help their patient achieve for the day. This person said patience, and if you're trying to convey an important piece of information, I find that associating it with a scenario rather than telling them the facts about XYZ is much more helpful. Oftentimes, your orientee can get overwhelmed with all of the info coming at them so quickly, so the scenarios help the important things to stand out. Best of luck. This person said, I have been fortunate enough to train so many nurses who were CNAs first. I always have to remind them to delegate their tasks to their previous peers so that they can focus more on nurse-oriented tasks while they are learning. I promise them when they are trained, they will be fast enough to help with all the tasks of caring for the patients. And I apologize for Caesar whining. Anyways, next advice. I gave a pocket notebook that I had started for several of mine. They had phone numbers and facility policies to reference that were the most commonly used. Praise them in public. If you have to correct them, make sure it's done in private. Be open to listen to their questions and their ideas. Watch to see where and when they need more guidance. This person says, use your phone as a timer or a reminder for IVs or heating pads, and remind yourself to eat or drink during the shift. And someone else said, above all else, be kind and remember you were once new and nervous yourself. This person says, read the chart, make sure they are introducing themselves to the patient before they do anything, and ask if there is anything they want that you can get for them. And this one I really, really liked, and hopefully you guys will understand why once I read it. It says, ask them to have verbal diarrhea with you. Sounds gross, but just bear with me. I'm thinking I have to do oral care in 2 hours. Is this compatible, etc.? It really helps me guide priority thinking. Obviously, don't disrupt thoughts. Just discuss things when you have a slower moment. So obviously, you wouldn't want them to be having this verbal diarrhea with you if you are like in the middle of patient care or like administering medications or anything like that. But obviously, when you guys are sitting at the nurse's station and kind of like not in the middle of something, then that's a good time to have this type of conversation. This person said, don't assume they know anything. Ask them why for everything they're doing. This person says, give your orientee space to learn, but don't let them hang themselves. Yes, it is sometimes baby steps, and we all have concepts that we struggle with. Until they are used to you, you need to talk, not just about work. Treat them from day one as a colleague that you are introducing to a whole new wonderful facet of nursing. See the wonderful and colleague piece. If our orientee sees us as liking where we are at and that there is already respect and camaraderie from day one, you bring them into the fold. I think that's really good because I've done orientation at facilities where I felt like I was not even welcome. Like I kind of questioned why I was there in the first place, because sometimes it just seemed like they didn't want me there, or like I was basically burdening them with my presence. This person says, assess their knowledge base first. What experiences or jobs have they had? Where they feel strong or weak. Show them how to make a brain specific to the unit. Remind them that there are no stupid questions. Take them on a tour of the unit. Show them landmarks. For instance, the supply room is the third door on the right past the nurse's station. Explain the floor routine for the shift as far as meals, rounds, whatever. And she said, I precepted/oriented in the NICU. When we had some downtime, I explained pathophysiology of common problems that we saw and gave them handouts as needed. This person says, first day, let them follow. Let them see how you do things. After that, be patient, be kind, and for the love of God, don't reprimand them in front of the patient, and good luck. This person says, explain everything, assume they know very little. I'd rather have someone show or tell me every step as opposed to assuming that I know what I'm doing and then I mess it up. Provide patient education with every patient contact. The orientee will also get to hear the information. I'm continually surprised at what orientees mention as new things they learned that they didn't go over in school. This person says, make them accountable for their learning. They need to be an active learner, not passive. Have them look for stuff instead of you showing them. They'll remember better, like a scavenger hunt for supplies, etc. Get them into the practice of looking up medications or looking up info they don't know. Make sure they're taking notes, whether it's paper or digital. Have a narrative way of giving care. You're teaching both the orientee and the patient/family. Explain as you are doing things. pick their brain, throw them a curveball so they have to think. I have just a few more, so please bear with me. I know this video is getting kind of long. Always remember you were once new and learning too. After initial 3 weeks, take the hardest patience possible to help learn the difficult stuff. Talk to them, not down to them. Always ask if they have questions about what they are learning and the place they are at during that time frame. Help them to make connections with theory to practice, how to organize their day, how to prioritize, operate safely, improve communications, support each other, and most of all, to not accept nurse bullying and report it. And this person said, remind them that lack of oxygen to any body part results in pain. And then I have 3 more, and then that's it. This one says, if you are the preceptor, then helping the new hire write down daily, weekly, or monthly goals and then review them together. Also, a debrief at the end of each shift to evaluate or identify opportunities and to discuss what went well. The new hire needs to take ownership of their orientation, speak up when they have a question or need, and be open to feedback. Seeing another person excel that you have mentored is great. This person says, be kind, be kind, be kind. And the last person said, to remind them, if you don't know, always ask. There is never a dumb question. So hopefully if any of you guys are precepting, or if you're training someone and you kind of run into a little bit of conflict or difficulty with that, because I know sometimes, you get your routine down and you don't really want to spend extra time teaching somebody. I've run into that myself, but make sure that you are teaching them what they need to know, obviously. If it's a student, giving them the grace to make mistakes, even if it's not a student. I mean, people who are newly hired can also make mistakes. Anybody can make mistakes, but just be kind. Hopefully you guys found this helpful. If there are any other topics you guys would like me to talk about on my channel that is medical related, please let me know, and I will talk to you guys again in my next video.